maybe try to keep it. Go ahead. Thank you. Thank you all for joining us. We're going to be talking about just an extremely important topic today. And we have a panel, an amazing panel that is going to help move along our conversation. And what we're going to be talking about today is the mental health impact that that COVID-19 has had on communities, and also really delve into solutions and ways in which our amazing panel has been leading the way in terms of dealing with this particular crisis. So my name is Garth Graham. I'm Director and Global Head of Healthcare and Public Health Partnerships on YouTube. And this panel, as I alluded to, is going to be talking about this major challenge we've been facing around mental health in the context of COVID-19. So 2020 has presented a stunning public health crisis around the globe, but also a secondary crisis in mental health. The isolation coupled with the worry about community, physical, and economic challenges caused many to experience heightened depression, anxiety, and mental health consequences. And we have launched a number of activities, and you'll hear us talk a little bit about that. But YouTube launched the With Me campaign within this year in an effort to foster that feeling of community despite our physical and social distance. And this panel, we're going to talk about some of these challenges, engaging experts and influencers that are working to address our mental health pandemic at scale. So you're going to hear from myself, Elisha London, who's founder and CEO of United for Global Mental Health. You're going to hear from Daniel Howell, who's an amazing author and mental health advocate. I love Daniel's work. Katie Morton, I also love Katie's work, a licensed marriage and family therapist and co-founder of Happyable. And Michael Actor Smith, co-founder and co-CEO of Calm. Again, I'm someone whose work I've incorporated into my daily life. So I'm going to go around and ask each of them to both tell us a little bit about not just themselves, but also their work. And why don't we go ahead and start with Katie?
Yeah, thanks, Garth. My name is Katie Morton. I'm a licensed marriage and family therapist. I've been creating on YouTube since 2011. And my goal when I started the channel was honestly just to educate and empower people so that when they reached out for help, they knew how to do it, because often we don't know what we don't know, right? We don't really know where to start and what questions to ask. And so I've hoped that my channel is like a catalyst to get people reaching out, speaking up, and talking about mental health. And I have a podcast I've created in the last year called Ask Katie Anything, where I answer any questions from my audience about mental health related content. I also had a book, Are You Okay?, come out in December of 2018. And my next book, Traumatized, will come out this September. So trying to reach people where they're at and educate and empower as many people as I can.
Thank you, Katie. Daniel?
Sure. Hi there. My name is Daniel Howell. I'm also a YouTube creator like Katie. I'm a comedian and an author, and I'm someone who very much started out just making comedy videos, talking about things that happened in my life, my thoughts in the world. But as time went on, I realized the power of personal stories and sharing vulnerability. Generally, I would say the worse an experience in my life is, the funnier it is for other people to laugh at. I don't know. I mean, that's just something I just realized when people are saying, haha, laughing at your pain. But eventually, I ended up opening up about my own mental health struggles, because there was a period of a few years where I was really struggling with depression. And I decided one day that I needed to talk about this on my YouTube channel. And this was something I was quite scared to do, because mental health was definitely my topic, even just a few years ago. And I was so surprised to support the amount of information that apparently people didn't know, the misconceptions, what people said they could relate to people that they loved with. And from that point onwards, really, it was a shift for me where I realized that the more vulnerable and honest we are when we talk about these really difficult things with mental health, it can really make a profound difference. And now I am an ambassador for an amazing UK charity called Young Minds that helps to fight for young people's mental health. And I am also writing an upcoming book called You Will Get Through This Night, which aims to...
Thank you, Daniel. And I've just found your work just absolutely amazing. Next, Elisha. Elisha, do you want to go next?
Yeah, sorry, internet freeze there for a second. So my name's Elisha London. I'm the founder and CEO at United for Global Mental Health. We believe in a world where everyone everywhere should have someone to turn to when their mental health needs support. And we work on accelerating political and financial action to help that come to be. This is an issue I never really thought that impacted me. I think like a lot of people, until I had my own experience and had suffered in trauma in 2013. I was diagnosed with PTSD and struggled with depression and became quite suicidal over a couple of years. And I did get the support I needed. And after that, had the opportunity to lead the Heads Together campaign, spearheaded by the Duke and Duchess of Cambridge and Prince Harry here in the UK, to tackle stigma and open the conversation on mental health, and learned a lot about mental health in the process. One thing that I really realized with my background before my experience in health and international development was just the lack of global action that existed on mental health. So we set up United to do that work. So we have incubated and run a range of initiatives bringing together global actors to accelerate action. The Speak Your Mind campaign, we found incredible advocates who are fighting for national change at their own country level after mental health has been neglected for so long, and Citizen Voice calling on governments to invest. We lobby donors, we run the Global Mental Health Action Network of professionals to learn from each other and take collective action. And we're really pleased today to have launched and supported the launch of the Global Business Collaboration for Mental Health, where global businesses are calling on CEOs to commit to prioritize mental health in the workplace. We've also really pleased to be helping and partnering with the WHO and the World Federation of Mental Health.
Thank you, Elisha. And I'll ask Michael.
Hello, everybody. I'm Michael Acton Smith, and I'm the co-founder and co-CEO of Calm, a mental wellness brand. And we have an app with about 100 million downloads all around the world. And it's been a pretty extraordinary journey. I'm incredibly passionate about mental health. But when we started back in 2012, people thought we were a little bit crazy. Hardly anyone was talking about it. It was very stigmatized. People would back away from us at parties if we mentioned mindfulness and meditation. We were the slightly weird ones. And fortunately, that has been changing rapidly over the last decade. The stigma is fading away. Mental health is stepping out of the shadows and into the light. And so many people are now getting the help and support they need. So meditation, as I say, is where we started. We have a wonderful teacher called Tamara Levitt, but we also realized how important sleep is. We all do it, 7.5 billion people every single night, and not enough people were looking after their sleep, and that's a massive contributor to our wellness, mental and physical. So we created something called Sleep Stories, where you can go to bed listening to a bedtime tale with music and sound effects. We've had Stephen Fry and Kate Winslet, Matthew McConaughey, Harry Styles read you to sleep. So those have been a lot of fun and very, very popular. Then we add music into the app to help you change your state. And so it's been, as I say, a fantastic journey. And ultimately what we want to do is make the world a happier and healthier place. And we think it all starts from up here, the mind, the frame through which we see the world. So happy to be having this conversation today on this incredibly important subject.
Thank you. Thanks, Michael. And thanks for what you've done, I think, across the world. So let's start with a question for for everyone. And you've all been tackling this from so many different angles. What are some of the biggest misconceptions about the mental health crisis, the ongoing mental health crisis that we all have? I'll start with you.
Sorry, I think that's one of the first discussions. I think it's changing, and I think COVID has enabled this, but this idea that it doesn't affect all of us. But we all have mental health. It affects whether our mental health is good or whether we're not well and we need support with our mental health. We all have mental health. And so I think there's a misconception of the scale of importance. But I think the main crisis and the one that we're really fighting to change is, I think this is a crisis of inaction and not just one of scale. Because despite the fact that everyone has mental health, up to 1 billion people have struggle with their mental health and need support across the world, that access to support just isn't available to the vast majority of people. And there's a history of neglect, of not providing that support. We find ourselves in a situation in COVID. This was a crisis before. It's accelerated now, and still we're not seeing the level of investment that's needed. And up to 90% of people in low-income countries have no access to any support. And so this really is a global crisis of inaction.
Yeah, and just to piggyback on what Elisha said, because I agree 100%, is that we talk a lot right now about our physical health, right? People are worried about catching a virus, and we're so concerned about that and taking care of that, yet we've been neglecting our mental health. And I always talk to my audience about the fact that we as a society need to start talking about them in the same way, because our brain is really just the hard drive of our body. And if we don't take care of that, I talk on my channel a lot, I say, working together towards a healthy mind and a healthy body. And I think that the more we can consider these things the same and part of the same puzzle, the better we'll all start feeling. And the inaction that we've been feeling as a result of this isolation and the stay home orders. I mean, I'm in California, and we've I mean, I've been in my 1,000 square foot apartment pretty much all year. And I think that inaction and the stagnation in our bodies of this stress response that we've been thrown into is what is leaving us feeling irritated and agitated and, maybe depressed, not sleeping as well. And there's just so many pieces to this. And I think the more we can start talking about mental health is physical health, it's just health, and we need to prioritize it.
I also think that one of the points that you made was amazing, which is that this has exacerbated because of COVID, but this isn't a new problem. This isn't a new mental health crisis. There was already a global mental health crisis of misunderstanding and not enough support and stigma. And much like everything else in our lives, what this pandemic has done is it has exposed all the problems to us, and going forward is continue things the way they are. I mean, we've seen the World Economic Forum talking about this great reset where, hey, are we actually going to learn some lessons from this experience that we've been through over the last years? Not just, how we live our lives personally and the people that we talk to, but the businesses, the leaders. It turns out that the status quo, the way things were going anyway, wasn't good enough. There were already problems. After this, it's just laid everything to bear. So if you operate a system an inch from the brink of disaster, and then suddenly a pandemic comes along and has, kicked you down the stairs, I think that it's shown the time for action was yesterday, and we really need everybody. Mental health, where it's all about intervening in a crisis, but really proactively preventing it, helping people to understand something, teaching people to learn how to look after themselves, and, as everybody on this panel is doing, helping to break down the stigma by just talking about it.
Yeah, I'd agree with all of that completely. I think there's an often quoted figure that 1 in 4 people will suffer from a mental health issue in their life. And I think it's actually much greater than that. It's 1 in 1. If you have a body, you have physical health. If you have a mind, you have mental health. And we all need to look after it. And as we go to the gym or go jogging to keep our physical health in check, we need to do the same kind of care for our minds, whether that's meditation, good sleep, or making sure we just take a few deep breaths throughout the day. This is absolutely vital. And I think, as I say, it's changing now. We're starting to treat our minds with the same care and attention we do our bodies, but we've still got a way to go. Fortunately, we're heading in the right direction.
Yeah, and it's comforting to hear you say, Michael, that you think we're heading in the right direction, because as Daniel said, this has been a crisis that has been unfolding slowly in real time prior to COVID and just accelerated. Are there things that you all are seeing that are effective ways that you think of addressing mental health needs? And can you give us some examples of 1 or 2 things that you think are important for us to understand in terms of effectiveness?
I could jump in first here with a few ideas. We live in the age of attention. Our attention is one of the most valuable resources out there. And so to be able to take control of where we put our attention is one of the most valuable skills of the 21st century. And this is why meditation is so valuable. It allows us to, instead of being yanked around by our phones and our screens, to become the controller of them, the puppet master, and instead of the puppet being yanked around. And that changes everything, because phones and social media and screens are not the problem. These are all tools, incredibly valuable and powerful. It's how we use them. If only we can be a little more mindful instead of mindless on those devices, we change everything. So one just little example is most people wake up in the morning and the first thing they do is reach for their phone. And a huge step I've made is just keeping my phone on airplane for the first half hour or so of the day, allowing your thoughts to kind of bubble up instead of getting sucked into how many likes your Instagram post got or what's been going on in the White House. And that just slow rise into the day is incredibly valuable.
That's I love that,
Michael. Yeah, exactly. Sorry, I just wanted to. I love that, Michael. I'm going to start doing that tomorrow to help improve my post. But Daniel, I knew you were going to say something.
Yeah, like everyone said, I think that understanding mental health isn't ephemeral. It's not just, oh, I have these thoughts and feelings, I can't control them. Is that actually, there is science. There are things that you can do. There are ways you can change your lifestyle to be healthier. You can change your mindset to be healthier. There are things you can do, like Michael says, that can have a real tangible effect on your mood. I think what I have experienced with addressing mental health from my, story of opening up about mental health is just the power of every single person having a story and the ability to influence the world around them just by being open about their vulnerability. Vulnerability isn't inherently a weakness. If you have the strength to tell somebody that you are feeling stressed or you are doing something commendable, you're being brave enough to admit fault, but also every single action that someone takes to just share how they're feeling and ask another person how they're feeling, it breaks down the stigma that every single one of us has, that we feel uncomfortable, that we can't talk about these things. And I think everyone here is an example of kind of a mental health ambassador. But I would like everyone watching this to think that every single person themselves can be an ambassador for mental health just by feeling comfortable. You don't have to have, a big book-worthy mental health story. Say to somebody, hey, I just want to share, I'm feeling quite anxious today. If everyone in the world did that, I think we'd all be a lot healthier and happier.
Mm-hmm. I agree. And just to kind of share some other ways I think we could assist people, I think a lot of it's just access. The reason that I think all of us are doing the work that we're doing is because you need to meet people where they're at, right? And we need to be able to offer some help and some resources. And I'm always telling my audience, I love, Dan, that you share your story with the world, because I'm always telling my audience that it's with my expertise and your experience that we're able to make change and that we're able to start feeling better and helping each other. And I really think that the more resources we can have for people, we all, even if we can't donate money to certain things, or we can't afford a lot of things, we all have time that we can offer, and we can offer up that time to help and assist other people who are suffering and struggling. And I think that that's really the key for me, is just access and acceptance, because people being brave enough and being vulnerable enough to share their story should be something that we support and that we encourage, and that we then offer up our own resources to help in any way that we can. And then together, right, it's then you start the movement, then together we can all start feeling better.
Yeah, I think that's great. I would agree with absolutely everything that's been said. And to add a slightly different perspective, this is actually a question that we asked ourselves a couple of years ago, to say what is needed. And I think it's really important also to think about, who are the experts who've been thinking about this for a really long time? Who are the advocates who've been fighting for changes across their countries? I would really encourage people to seek out who those organizations are, like Young Minds, we heard earlier. They're brilliant here in the UK, just one example, and others like them, because there are experts from experience who've been doing this for a long time, and actually we need to get behind them. We brought together 2 years ago now advocates from across 15 countries and asked them, what do you need to change in your country? And it was fascinating. They all said, yes, we need public education across the country. This is something we all need to learn. Very, very, very important everywhere. We need an investment into the services so that people have trained support, often community-based support, not necessarily psychiatry, which mental health has been for a really long time. So we need to get it out into the community. And actually we need rights. I think it's different in every country, and it's really important to acknowledge when we're thinking globally, what each country needs is different, but there are experts in the country that know. And in some countries, just protecting human rights of people with mental health conditions is really important. So, in some countries, the Lunacy Act is being repealed in Sierra Leone, that has people incarcerated for having a mental health condition, or works on banning shackling, which is a form of it's a practice that can happen when there's no treatment available. So I think we can think about our own individual mental health and the practices we can make. I'd also love to encourage people to think about what are those big systemic changes we need, and how do we be advocates to build systems that care for people, that are just and led by those with experience.
I like that, Elisha. We're going to come back to that to talk a little bit about the big systems changes, the government, the leaders, and the things that we think should be a part of this, and what you think should be happening. Daniel alluded to something, and I want to try to make some space for us to discuss it a little bit. A lot has happened with the pandemic this past year, and it's a crisis on top of a crisis. I love the way you said that we're 1 inch away from the edge, and it's just kind of tipped us over the edge. So what are the kinds of things we should be thinking about to address the exacerbation of what the pandemic has done for mental health? And is there anything that gives you hope, that you've seen out there that, we would want to kind of think about at scale, in particular around this kind of intersection of what the ingredients of COVID-19 has done to mental health?
I think that what we have seen is the kind of universal humanity that we all have. When it comes to mental health, we all have minds. We're all humans. We have brains. We have a similar range of emotions. And a lot of people usually think when they're going through some kind of mental health crisis that it's very personal to them and it's something that other people can't relate to. But the truth is that we all can. And I think that, as much as Michael's right, that the information overload from the internet can often be a bad thing for our mental health, one of the rays of hope piercing through the cyberpunk dystopia is just that feeling of community. And that's something that I experience every day when I go on YouTube. YouTube did this great #StreamWithMe campaign where they got everybody, sharing their day-to-day experiences and their lifestyle. And it made people realize that they're not alone in what they're going through. And, as we've said, I think the stigma is getting better. The fact that we're talking about this right now on the World Economic Forum is a sign that things are going in the right direction. We could look around at all the things that have been pushed to the edges of disaster, people not being able to pay rent, working from home, their relationship with their families, and also the international aspect. When I talk about mental health, it's from the perspective of someone in the UK. And I think here in London, there's a fairly good conversation around mental health. We have pretty good healthcare here in the UK. And then I get comments from someone. So I think that, it just goes to show that we are all connected in some way, but our experiences can be quite different.
Oh, I love the way you said that. Love it, love it, love it, Daniel. I'm sorry. Let me open it up to the rest of the panel as well. Thoughts on how you've seen things that give you hope in the light of the amazing year we've just had.
One thing that I gave great hope right at the beginning, and I'm sure you can actually, from experience and Calm, you'll have some great stories to tell here, is just the acceleration of tele support, whether technological support for mental health. I remember in the first month of the crisis, we'd made as much progress on mental health and providing support virtually in 10 days than we've made in 10 years across mental health services. So I think it's forced us to become innovative and for the mental health community to think how to do things differently. And a lot of organizations around the world have pivoted to do that. Some governments have kind of got behind that too, and how to scale support digitally. And I think that's a really solid thing for the future. I don't think it can overtake the provision of the face-to-face when that does come back, but the acceleration of how to provide virtual support is, I think, a really hopeful thing for the future.
Yeah, I think that's been fantastic. I think one of the other big broad things is just this: the whole world seems to have had a bit of a recalibration, a reset. It's like a computer with too many tabs open. We've shut down and started up again, and it's caused many people to reevaluate their lives and what they were doing. Everything from relationships to jobs to rumination. We've been sleepwalking, and many of us are waking up. So even though it's a health crisis and there are so many other problems, I think that's been positive. And one other thing I'd say that we've seen personally at Calm is the massive growth in companies now offering mental health solutions to their workforces. I think when COVID hit, they were looking for fast, simple, relatively cheap ways to support their employees at home. And people have realized that this is amazing. A few years ago, the idea of a CEO bringing on board mental health benefits or teaching their workforce how to meditate would have been laughed at. The idea of your staff sitting in the corner singing Kumbaya and holding hands and kind of chanting was the old perception. And now it's almost table stakes. Why would you not want a workforce that is more resilient, that can manage their stress, that sleeps better, that has better emotional intelligence? I think every company in the world will hopefully be offering this over the next few years.
I agree. And if I could jump in quickly here, I'm give huge hope in the fact that the Global Business Collaboration has launched today for better workplace mental health. It's launched at Davos. It's fronted by HSBC, Deloitte, Unilever, Salesforce, Clifford Chance, PHP. So really big multinational organizations looking to scale up mental health support and figuring out how do they do that across multiple countries all around the world. To see CEOs stepping in and leading the way, they're calling on other company CEOs to pledge to come on that journey, recognizing nobody has this right, but they're going on a learning journey and they'll collaborate and learn together. But that gives me great hope, that level of leadership that we've just not seen before. And there's an opportunity for everyone to get involved and learn. And the great thing about it is they're making sure that as they go on a 6-step learning journey, as to implement practices that we know work, they're all based by evidence as well. So it's informed by the experts of what really works when it comes to workplace mental health, and then encouraging others to come on that journey too.
Yeah, and I'll add one last thing.
Oh, please,
Sorry,
go ahead.
Garth, go ahead.
No, please.
I was just going to say, for the hope for the future and the positives, I think one thing we can all agree on is this year, a lot of people have risen to the occasion, right? Supported other people, showed up for people in a bigger way. I think that so often it's easy to focus on the negative. I mean, we know our brains are primed to seek out threat, right? To prepare us for fight, flight. But there has been a lot of good. And I think a lot of people that have reached out and supported, especially my community now more than ever. I see them in the comments commenting back with each other. Oh, I went through that too. This is something that helped me. Maybe give this a try. Or here's a video I found that was really, helpful in my journey. And I think that even though this has been a very trying and difficult year, there's also been a lot of positive things. And I've also seen to the point of, telehealth coming on board more so now than ever. I've seen a lot of them offering it for free or for a very reduced cost to our frontline workers. And again, just another representation of the good in people and that we are coming together to support one another. And I think that's always a good thing.
Yeah, I hope that businesses carry their weight with that, because, it's really the mental health crisis exacerbation from COVID is a symptom of the prioritizing of people over profit. And general humanity aside, I hope that any business leaders recognize that at some point you need to do what Michael and Katie are saying and invest in the health and the happiness of the people that you are responsible for so they can grow and be better. And, whilst I'm sure they'll appreciate having more enjoyable lives, I'm sure that we'll all be fitter, happier, more productive people as well. So it's, it doesn't all have to be stress. There's a
Well said, Daniel. So along the point you just made, Daniel, thinking through business leaders, I think at least you kind of talked through the systemic challenges that were there and examples of ways in which people are thinking this through. Thinking it through at that level, what are some of the things you all have seen in the past year? Telemedicine is a good example that we just talked about, that you've seen in the past year, that examples of these kind of big systemic changes that either have happened or, to Daniel, to your point, that need to happen when we think through, again, kind of the whether it be in the business sector, health policy, those kind of intersecting areas of health and public health. What are some of the things that you've seen that again has been impressive, or things, to your point, Daniel, that we should be seeing to really kind of make change? Elisha, I'll ask you to go first, talking about, you mentioned a little bit about businesses coming together. So maybe if you wanted to start first.
Yeah, so we touched on the workplace. I think that's a really important one for all businesses to do. And we really hope that CEOs, really at the CEO level, will pledge that, because you have to integrate mental health right across the business. And it's relevant to everyone everywhere. I think two things that haven't happened so far, which we have seen start to happen in the last year. One is a really truly citizen movement for change. We haven't had a movement of people raising their voice, calling on their leaders to invest in this. And that needs to happen if our leaders are going to respond. And we've seen it through great movements right throughout time. And last year's World Mental Health Day, we saw really for the first time coming together a whole range of organizations. There was a global march across the world, across 24 hours of citizens raising their voice. We had TikTok come on board with the official campaign and calling for people to move for mental health and to move funding forward and invest. And I think they're the kinds of campaigns that are really starting to get traction, and would love to see more of that. And I think certainly during COVID, we had a lot more people wanting to get involved in those sorts of movements. I think the other one that is really important is that we are starting to see governments respond. And if you're talking about systemic change, governments have to make these commitments. And for a little bit of context, before COVID, mental health received on average 2% of a health budget, which is nowhere near enough. And it just demonstrates the level of deprioritization. During COVID, around 93% of countries have actually had their services disrupted or halted, according to the WHO, and only 17% have increased. But we've started to see increase of support, particularly through telehealth. But actually, this week, the WHO has an executive board meeting, and we saw more countries step up and say, we want to tackle mental health than we've seen before. What we're starting to see is, as this is important to individuals, leaders are starting to respond. And those, the seeds of starting to see this movement grow gives me great hope, because we have a lot of work to do, but this is more important to people now than ever before. So I'm really hopeful for the future.
Thank you.
One area that I have seen, just to build on that, is in schools. And if you want to change the world, you start with the youngest generation. And I remember seeing a quote years ago by the Dalai Lama that said, if we could teach every 8-year-old in the world how to meditate, we could eradicate violence in a generation. And I think that's pretty powerful. And again, as I mentioned earlier, there was stigma around teaching children mindfulness and meditation in schools years ago, and that's changing. So many new schools are adopting it. Even something as simple as just 1 minute's silence before the start of the school day is valuable. So we offer quite a lot of free resources at Calm for teachers around the world. We've got about 250,000 teachers that have signed up to, again, just bring a little bit of mindfulness into the classroom. And I think starting from that young generation that will flow through as they grow up is going to be valuable.
I would like to say that I've experienced that firsthand. I think me and Katie probably do, because we spend all our days looking at the younger generation, comparing it to our own lives. And I think they're talking about mental health. They know about it. They've educated themselves. There's no judgment. There's no stigma. They're open about how they feel. And that gives me hope for the future. I mean, Michael's talking about school. With the work that I've done with Young Minds, they often talk about how the immense value of talking to adults and teachers just have no idea. They're struggling. They've got a young person going through mental health problems and they don't know what to do. And then, now hopefully you have teachers learning, you have the young people learning themselves, and the people at the top making the decisions. I hope they, going forward, better than cure, if we don't just have a token service to intervene when someone's at the brink, on the edge, but in fact we keep everybody educated and healthy and happy the whole time, then that will be a lot better for all of us. And I hope that going forward, it's the science movement, because right now there's a lot of questioning what experts and doctors and this, that, and the other say, but I hope everyone here would agree that when it comes to mental health, there's a lot that we know, there's a lot of truth, and rather than conspiracy theories and judge, there's a lot of good knowledge we can learn and share.
Agreed.
Yeah, I kind of want to piggyback on that conversation, because I love it all, and I think that we do need to educate and have more resources. It's like sweeping, right? We need more funding to go to schools, because I've learned from my audience that not all schools have a school counselor or a school psychologist or any resources for children. Teachers already, I feel like, do so much that we need to have some mental professionals that are there and can be a resource to kids, because I think we all would agree that if we had emotional intelligence and an understanding of it's okay to feel how we feel and some support when we were younger, especially like in our early teen years, we would have all benefited and felt a lot better as we go through that tough transition in life. And so I think having those resources are really great, and it's something that we should put more kind of oomph behind and push people to make change. And then something that I have seen happen this year, as far as from the therapist perspective, is, for those of you who don't know, as a licensed professional, I'm only licensed in the state with which I took my licensing exam. Therefore, I cannot treat people who don't live outside of my state. However, there has been shifts in a few states across the US, and I don't know how it goes. Every country has their own laws and regulations, but some states have loosened those laws and allowed people through telehealth services to be able to offer their, their expertise and their support across state lines. And I really think that would benefit those who live in more rural or, less populated communities, or just communities who maybe are already tapped, right? There's only so many people that as a therapist I can see each and every week. And I think the more we spread our resources out, the more people who need the help can receive it.
Yeah, and Katie, that just speaks to how we need to evolve the system to be where people are and where patients and our communities really are. But along those lines, this next question is really specifically for Dan and Katie. Along the lines of being where people are, you all have been engaging communities on this discussion around mental health. What's the secret to that engagement? How have you dealt with the issue of stigma? And how have you broken down the barriers that, either the cultural or other related barriers that people bring to the table when they're talking about, very many times serious clinical issue? But how have you worked to break down the barriers, particularly around stigma?
Yeah, I can go. I think honestly, it's just by continuing to talk about it. A lot of what I try to do is just normalize, because people don't realize how common it is. Michael was saying earlier, the statistic we hear thrown around a lot is 1 in 4 are affected by mental health globally. And I think it is more like 1 in 1, and honestly, I think we can all also say that if it's 1 in 4, that means all of us have known someone, and therefore we too have been affected. And so I think that the more we shed light on things, I always tell my audience, there's no question that's too taboo to ask. There's nothing that I won't address. And I just have always answered the things that maybe people have been afraid to answer. A lot of people are scared to talk about abuse or self-injury or suicidal thoughts. And those are all things that I will always continue to talk about, so that people, when they are seeking that information, they find a positive, hopefully helpful resource.
Yeah, I would say that when I opened up about depression, it was quite terrifying. I think that there was more of a taboo even 4 years ago than there is today. And I was expecting, honestly, I was braced for a lot of misunderstanding, a lot of judgment. I was wondering how it would affect my career, if my friends would think of me differently. And that's because I had that mindset of not appreciating how not just depression, but all mental health struggles are. And when I posted this video and I was braced for impact, what I got was the complete opposite. It was total embrace from 90% of the people, not through what I was going through. A lot of people that did suffer from depression were like, thank you for telling me your story, because now I know how I can share what I've been going through to my friends and family. People that didn't relate to what I was going through said, well, exactly, 1 in 4. I know someone that this applies to, and I now feel like I can talk to my friend. And you saw it happening in real time down in these YouTube comments, people just saying, hey, I'm going through this. Someone else saying, it's okay. Did you know that you can do that? And it was such a profound moment of realizing that we feel judged for this kind of suffering, but it is universal. And if we talk about it, it doesn't just help us, but it helps other people. And I've experienced that myself. So I hope that anyone watching this can feel the same way too.
I love the concept and the reality of that in terms of we're all there in so many different ways, Dan. So thank you for that. Along those lines, Michael and Elisha, as with many health and public health issues, there are cultural dynamics, there are gender dynamics, there are maybe racial and ethnic dynamics in terms of how these challenges have either been visualized, experienced, broken down, and addressed. What kind of trends have you all seen, and what are some of the specific best ways you've thought of how to address some of these variations, particularly, again, whether that be culture, geography, and all of the facets that kind of define populations?
Yeah, it was a really interesting question for us, especially when we started Speak Your Mind, because the campaign is a global campaign. So how do you have a global campaign that's made up of many different countries that are all very unique on their mental health journeys and culture-specific responses? What we learned was, and really intentionally, was that actually priorities of a national government or a country have to be set domestically. And so we really listened and made sure that within that campaign, whatever's being called is a country community know what's most needed within that country. I think that's a really important first principle. Within that, there are a couple of broad sweeping trends. This year, the one that really stands out more than ever, it's always been there, but the call from countries, from the UN Secretary General, from Dr. Tedros, to integrate COVID responses as an essential service, an essential part of health for all, that is everywhere. And that's really common. And again, making sure that that's not just at the psychiatry level, but at community support level as well. Again, education, tackling stigma, protecting rights, and making sure that these things are invested. We keep saying these are the things that needed, but what isn't following is the funding and the commitments. And so we're really hopeful that that will come through. One, just on the political as well, just to touch on this year at the World Health Assembly, there was actually a global plan for addressing mental health from 2013 to 2020 that all countries agreed to. The plan overall wasn't met because that commitment and investment wasn't there across the board. That will be renewed from 2021 to 2030. And what's common across all of that is all countries need to commit, follow through on that plan, and put the resources behind it. And they'll only do it if they know that citizens really want it, which we are seeing. So again, just an encouragement to get involved in advocacy and make sure that those commitments, whichever country you're in, are made and followed through on.
Yeah, to build on that at Calm, what we've seen over the last few years is we've just been so surprised at the breadth of the demographics. It's everything from kids as young as 3 or 4, all the way through to end of life and everyone in between. If anything, we skew a little more female than male, probably about 70% female. But one of the big things we've tried to do is make this practice accessible and simple and relatable. And one of the great ways of doing that is working with celebrities and people who have a voice and trying to maybe add a little bit of lightness and playfulness and fun. We created a documentary about sleep that was 8 hours long called Baba Land to raise awareness of sleep. We took the GDPR legislation and turned that into a boring sleep story. We work with LeBron James, who's an amazing ambassador, showing anyone that mental health is something to consider. And so I think that's helped take a little bit of kind of the sting and the mystery and the uncertainty about these practices and show people that they are for everybody.
Yeah, and I love that, Michael. I've seen some of that work, and like I said, just crosses so many different cultural and various lines. So Dan and Kate, you've been championing this with your audiences for some time now. What have you learned from your audience within the process? Is there anything that going into this you thought of, but then really kind of learned from your audience as the barriers around stigma got reduced and people started communicating back to you about what they're thinking? Any interesting insights that you learned from your audience?
I think for me, it's that what I did for myself ended up getting legs on its own. It was like I planted a seed that then took roots and spread throughout the world, that my audience ended up becoming so engaged on this topic. I've had followers of mine that were just here for the comedy videos that are now ambassadors for the same young person's mental health charity that I support. And it's amazing to see how one person has, snowballed into so many other people. People used to joke with my channel, they used to say, come for the hair, stay for the existential crisis, which I understand. Profound truth to that, because that's my journey as well. But I silly, and what I've managed to achieve just by telling my story, really, I think it says something that everyone can take away from it, more than just robbing myself of the inability to make lazy jokes about mental health. I'd be like, oh, I'm so depressed today. I think, we can all joke about our mental health in a way that makes us feel seen and calm down. But now when I look at the comments, people go, well, Dan, watch your own video. I think we all know we can do something about our mental health now. So get up and go download the Calm app, see what happens.
Good idea.
Yeah, it is really cool to see engagement. When, that's the cool thing about being online is you get to look at the comments and hear what people are experiencing and how they're working through it. And I think the thing that my audience has taught me year after year is just how resourceful and resilient we can be. They, like I said earlier, they comment back and forth to one another, because I've always told my audience I'm just one person. I can't get through all the questions. I can't answer all the comments, but they do it for me. And I think just that sense of community and the necessity of it. I mean, I know it through research that we do need community and we need true connection. It's really soothing to our nervous system, but to see it play out and to see people rise to the occasion and support one another has been really, really great. And then on kind of like, not a negative note, but just on something that I've realized more recently, now more than ever, is just how many people in our world have suffered a trauma and how important it is that we continue to talk about things like that, especially with this year. I don't think we fully understand the long-term mental health effect of COVID-19 and the isolation and the health crises as a whole. And the more we can talk about it openly and honestly with people around the world, offer support, share in community, I think, hopefully we'll be able to bounce back more quickly.
Agreed. This question, Michael, I'm going to start with you, and then Elisha, and then we'd love to hear from others. As user interest has increased globally, what are some of the barriers that you've seen in terms of access? I mean, you're providing access to interventions at such a big scale. Are there things that you've seen that have been either barriers, whether they're the actual cultural barriers or policy barriers, or what are some of the things that you've seen that are impediments to people being able to get better access?
Well, one of the best ways to learn how to meditate is with a teacher in person. Unfortunately, that doesn't scale very well and is very expensive. So there's a lot of friction and barriers there. And this is why we're so passionate about the mobile as a device to reach the world. There are billions and billions of these devices everywhere. And most people around the world now have them. So I think that's a very good way of democratizing a practice such as this. Calm is free for 7 days, but it's a paid-for product, so not everyone can afford it. And we try and work with different groups that aren't able to afford it to spread it, from teachers to disadvantaged youths. So that's one area. And the final thing I'd say is, we touched on this earlier, but I think there is a big responsibility of workplaces to help their employees and support them and look after them and bring mental health, whether it be an app as a very light solution but valuable at one end, all the way through to telehealth and psychiatrists and more serious interventions at the other. I think tremendous responsibility of workplaces there.
I'd agree. Elisha, access at the challenges that you've seen globally?
Yeah, access, definitely. We've touched on it quite a lot. And just, again, to reiterate, this really varies country by country. Up to 90% of people in low middle income countries without any access. If you think about that for a minute, there's a huge job to be done to scaling up access to care. There for a long time was one psychiatrist in Sierra Leone. And so there's a huge amount of work to be done to scaling up that support. Digital mental health has been found to be effective, particularly if you have trained even non-professionals and professionals being able to provide support. It's really important they're trained, and it has been found to be effective. So particularly for depression and anxiety symptoms. I think for those with serious mental health conditions, it's more challenging. I remember actually speaking to someone in Liberia this year who has lived with psychosis and couldn't get to the hospital now and didn't know what was going to happen because there was just no access. And so I think every country is different, but that access along the spectrum of mental health conditions needs different solutions, but it remains one of the biggest barriers. I think especially when a lot of apps and even social media companies are thinking about how to provide that support, and often the biggest challenge comes And we found this during a report we did with the World Economic Forum, the Global Futures Council on Neurotech. It often comes that point of referral. So you can identify someone struggling online, you can have a quick chat, but you can't, it's harder to then provide the support that people need. So I think that's really at the heart of the challenge we have to scale up. It's about promotion and prevention and looking after our own mental health. The systemic challenge we have is how to provide that mental health for all. And digital is a really encouraging way of seeing that accelerate within the last year.
Mm.
Yeah,
You know,
I want to add to that.
I'm going to ask you, Katie. Please,
Sorry.
I was asking you to go. No, go ahead.
Okay, I wanted to add to that a little bit because there are a lot of systemic issues that we see. I mean, just off the top of my head, I can think of the amount of incarcerations that are actually mental health issues that haven't been dealt with, and the lack of training that our first responders have, right? I mean, I can't tell you how many cities have reached out and asked if they can use some of my content to train their police officers or their EMTs. These people are honestly usually the first people to, someone who's floridly psychotic or in a manic episode, or maybe someone who's acutely suicidal. They're the ones to show up, and we need them to be trained. And not every city in the US, we have what's called a PET team, or a psychological evaluation team. Not every city, not every community has those. Why not? Why don't we have more of this education? Why don't we have more resources? Or for even our primary care physicians, people often go there when they're depressed because their body aches, they're super tired, they think they might have a cold or have an illness that's untreated. We need more education there as well, more than just like one book or one part of a course where they talk about, psychological issues. And then kind of just to reiterate, what I really think needs to happen is the licensing of mental health professionals needs to be broader. We need to be able to help more people. Why can't I hop on a call with someone in another country or in another state at the very least to offer my resources and my expertise for them? Why am I limited to only the state of California? Or, we need to rise to the occasion so that more people can access help. So there's not just one psychiatrist in Sierra Leone, and how are they supposed to see everybody and treat everybody? It's impossible.
Yeah.
So along those lines, Katie, you guys you've had so much different experiences as you build this online movement, community and presence. What are some of the positives and drawbacks you've seen as you've been doing? Katie, let's start with you, given what you were just saying. But what are some of the things you've seen that, in terms of building this online presence, some of the kind of the positives and negatives that you've seen?
Yeah, I think the positives are honestly the ability to reach people, right? I mean, every day I'm amazed by the people that I get to communicate with online. Never could I have ever positively affected people in Cyprus or the UK or Australia. I mean, the fact that YouTube allows me to reach people worldwide is amazing, and something that I as a child could never have imagined. Even when I was in graduate school, and it was right after that I started YouTube, and YouTube at the time I thought was just like cat video, beauty or comedy, and and it's really grown, and I think that's really amazing. And so that's really the positive, is the connectivity in the community. I think the downfall, and I think we can all feel this, especially this year, because people are feeling irritated, upset, or isolated, and having a mental health crisis, is the cancel culture, the negativity, the trolls online. That's something that I'll never get used to, and I'll never fully understand why people would put their energy behind that kind of content. But I think obviously, we keep putting good out there, we keep supporting good, we keep, using our resources to help people, and the good will always prevail in my mind.
Here's hoping.
I know.
Yeah, I've seen a lot of the good side on YouTube. I'm very lucky to have built my audience over the years, which is a wonderful community of people that are open to discussing these things. I think that one of the issues, mission. I think that these days there's a lot of fake news and conspiracy, and I think if we're talking about global agendas, and one of the things that may be an important issue that maybe on a further panel is what do we do to make sure that people believe in science, that people follow experts, that people, you know, and when you think about this, really that's a mental health issue, because if somebody is turning to something that, you know, it's because man probably isn't doing a good enough job of providing people of their basic needs as it is. So I think that you know, as much as we're making sure that people are listening to experts, that people are believing in science, I think as well we need to make sure that people are living healthy and happy lives so that they don't become victims of a mental health crisis like that.
I love that. I agree with that. We got 4 minutes left with the brain power and viewpoints and all of the mental power, I would say, we have from the four of you. I thought I would ask you all to kind of close with what you see in the future. You know, what are the things? What do you see as the next couple of years? You know, Dan, you said it so well. You know, we were standing on the brink of this precipice for a long time, so it just took a whiff to blow us over. But we got a huge windfall. But what do you all see as the future and the things that should happen in the future? If you give me maybe 30 seconds to 1 minute each.
Sure. I mean, I think that, yeah, business leaders and people in government need to put their money where their mouth is. Talk about affecting their workforce. And I think that the good news is exactly like Katie said, I have a view into the future. I see what young people go through, and I think that the future is in safe hands, but why wait 15 years when we could take positive action now? So here's hoping. Let's reset.
Love that, Dan.
Mm-hmm. Yeah, I'll go next. I think the future holds the thing that we always said, look for silver lining, right? COVID has been terrible, but what has it shown us? That telehealth can be a real and sustainable and like an easier thing for people to access. And hopefully as things come online where everybody in the world has access to the internet, I know that people don't realize that not everybody has that access. I think as we bring those things on board, as telehealth spreads, I think all of that is going to be great. And I really think that these movements, I wouldn't be surprised if tech doesn't come out with more, you know, whether it's app-based things or HIPAA compliant, you know, more options for mental health professionals. Because if you guys don't realize, we can't just use Zoom or Skype. It's not HIPAA compliant. And there are certain things that we have to do in order to protect our patients' confidentiality. And I think we'll see those things move forward in leaps and bounds. And I'm looking forward to it.
Thanks, Katie. Elisha.
I want to, going back to the vision of why we do what we do, I want to see a world where literally everyone everywhere has someone they can turn to when they struggle with their mental health and they're unafraid to reach out. I think that coming behind the new global action plan that we agreed at the World Health Assembly this year, we've seen movements of young people, businesses, funders, all rallying behind it to make sure we can see a world where that's possible and no one's held back because of their mental health condition. You know, it will happen. We all have mental health, but we're prepared, we're equipped. And it makes us it helps us to achieve our full potential. And just as an idea to inspire, World Mental Health Day 2021, imagine if we all came together behind that vision with a united voice and how quickly we could accelerate and just using a moment in time to push that forward together. We're stronger together. Lovely. And that's what I'm looking forward to.
Michael, I'll give you the last vision.
Well, what a tough trio to follow. Well, I'm gonna look to the future by looking back. And if we cast our mind back to the 1970s when Nike was just getting going, and Phil Knight, the founder, was going jogging with a soft J. This was this new thing where people would throw beer cans at him and ask him what he was running away from. You know, physical exercise was this new thing. Doctors thought it would be dangerous for us to do physical exercise. Now, fast forward the last 50 years, look where we are now. There's a gym on every corner. Athleisure wear is everywhere. Peloton's a $40 billion business. We get it. Physical health is important. Well, I think we're right at the start of the mental health journey. And all of us on this panel and everyone listening gets it, but we now need to spread that message all around the world. And we will get there. The wave is beginning, but it's going to be an incredibly important, exciting journey that will change the life of millions. So yeah, very excited and very optimistic for the future.
Well said, Michael. So listen, I want to thank Elisha, Michael, Katie, Daniel, just for an amazing discussion. I hope when we reconvene a year from now, much of what you said will come to fruition. But I think it's part of the journey that we're on. So again, thank you, my panelists, for joining me, and thank you all who tuned in for this hour-long conversation that really left me inspired, and I hope left many of you inspired as well. So thank you all.
Thank you.
Thanks.